My name is Peter Oehen. I'm a psychiatrist here in Switzerland. I just retired now. I closed my practice end of the year, end of 2020. And I've been engaged in psychedelic therapy for many, many years. And I was able to perform a study on MDMA in PTSD years ago, and the last 6 years I have had, together with other colleagues here in Switzerland, licenses to work with MDMA and LSD in our private practices. So that's basically.
And how did you get interested in this MDMA assisted psychotherapy, and generally how did it start?
Well, I was introduced to MDMA by a supervisor when I was a resident doctor. That was in the early 80s, and at that time MDMA was not banned yet. So I was able to experience it in a therapeutic setting myself, and I was really amazed by the effects it had on myself and my own history and problems. And after that, I engaged in the Swiss Medical Association for Psycholytic Therapy for many years. I had a training then. There was a period of time in Switzerland from 1988 to 92 or 93 where several Swiss psychiatrists had official licenses to work with these substances in their private practices, and I had a training there in the method, and since then we together with my colleagues from our group, we have tried to get back to receiving licenses for that, and that has, in the last few years, also due to the renaissance of psychedelic medicine, it has been possible to work with that, with these substances in a legal manner now.
In what cases we can use this treatment, and for what disease it could be helpful?
Well, I started out with patients with post-traumatic stress disorder or basically trauma-related disorders, but you can also use this method or these substances with people who are depressed, who have obsessional compulsive disorders, who and many things like that. But these are the main indications: depression, trauma-related disorders. LSD also has a profound effect on cluster headache. You may know
Are there medical contraindicators?
Contraindications. Of course, if you have severe somatic disorders, severe cardiovascular disease, you might not use them, the substances, but or epilepsy. This can provoke seizures. Psychotic, a history of psychotic disorder is also not a favorable condition to be treated with psychedelics. These are the main things. The most important thing is that people who are must be willing to engage in this kind of therapy. And these substances should not be used to force people to give up resisting or to make them willing to cooperate in therapy. It is important that people know what they are up to, what will await them, and also be informed about the difficulties that they can expect to come up, because it's not an easy thing, this kind of therapy.
And generally, what are the effects of this method? Because I wonder if it works in every case and if all the patients gets better.
It doesn't. It is not a wonder therapy. It doesn't work with everybody. There are people with whom the method fails. We can't, from the experiences we have up to now, we don't know exactly what the reasons are why people don't get better. For example, with depression, it's probably a mixture of the history, the personality, and the chronicity of the disorder itself that may lead to no improvement, or even some people get worse afterward. There's a lot of enthusiasm about this, but we must know that not everybody, it's not suited for everybody, and it's not everybody gets better automatically. Yeah. So what are the main effects? Well, it depends on, you have to differentiate between MDMA and the other hallucinogens like LSD or psilocybin, because MDMA is much more easier to handle for the therapist as well as the patient. Do you hear me?
Yes, yes.
The screen was frozen for a moment. Okay. So, MDMA just puts you in a positive, emotional, and cognitive state of mind where you are where defensiveness is lowered, and there's more acceptance of the inner conflicts and of traumatic events. There's a better tolerance of difficult emotions. The so-called window of tolerance is widened, and there's a better recall of the relevant history, relevant points in history, and of traumatic events under MDMA. It depends on the setting you have. I'm talking about a therapeutic setting now. If you take MDMA on a party or in nature, you have a different focus and you have a different setting, and these effects will probably not happen. But the effects are similar in terms of the positive emotional cognitive state of mind that you get into with MDMA. Mm-hmm. And so there's also a release of tension, and opening up towards others and towards life in general, and much more acceptance of how it is. Now, the hallucinogens like LSD or psilocybin, they do basically the same as MDMA, but they also, there's a feature or an effect called the ocean, or how do you say, the boundaries of the self are loosened or dissolve. And this can be really scary, and this leads to a much deeper experience in terms of the biographical history, and also in terms of the structure of the personality and the self, and also does more to question values and beliefs.
Mm-hmm.
So LSD is very much more confrontative in a therapeutic sessions. It goes deeper and has more profound effects. Although if there's a lot of research going on in terms of these, what are the usual effects of these hallucinogens. They are very similar to MDMA. It's more a question of the deepness of the effects, and how profound the effects are.
And so how exactly do this treatment looks like? There are more in group or individual?
Well, I prefer to work in groups, because the group can amplify the effects in addition to the drug itself. So it's often easier for the subjects or the patients in a group with other people who suffer from the same problems, and they often support each other afterwards, after or in between sessions. And it is also more economic. Well, you know, an LSD session goes for 8 to 12 hours, and you have to be present all the time. And the payment is for a whole day is quite expensive for individuals. And I worked in the individual setting only if people would not tolerate the group setting.
Mm-hmm. And
or if there were certain fears or other reasons why people could not participate in a group setting.
Mm-hmm. And are there any side effects? Because aren't people afraid of getting addicted to psychedelics, because they are drugs, and drugs generally are addictive?
Well, you can get addicted to anything, but with MDMA there are a small number of people who get addicted. I have not seen it after therapy or with people who had engaged in psychedelic therapy. I've never seen that, and I'm not aware of any people getting addicted there. But when you go to the party scene, you will meet people who are seriously addicted to consume MDMA every weekend or on and on. And people who take hallucinogens too much, they will. It's impossible to get addicted. There's no such thing as getting addicted to LSD. If you repeat LSD experiences too often, they lose their usual effects. So you won't have an effect anymore if you take it on a daily basis. So that's the thing to addiction. So it's what is right is pretty common is that people want to repeat the experience, who want to go deeper or learn more about themselves, but people have to learn that they need a certain amount of time in between experiences to integrate what they learned about themselves, their insights, and get over the corresponding emotions.
Okay, so I think that's all about our questions, and thank you very much for your effort and time. So
Welcome.
Yeah, like